Have you checked your time? If you haven't, you should do that right away because it is time for health check. Well, they say health is wealth. With that being said, let's dive into health issues today. If you haven't and you don't want to miss this, join us now as we take you on a ride, an exciting journey through groundbreaking health solutions, essential tips, and life-changing hacks that will truly benefit you. I am Promise A, and you are watching Health Check on Voice of the People Television. This is where we'll bring you enlightened solutions that could benefit your health and issues that provides practical solutions, and experts who have experts tips here, professionals that will give you practical solutions with insights from seasoned professionals across various medical fields. Today we are shining the spotlight on World Oral Health Day, celebrated this month under the theme, A Happy Mouth is a Happy Mind. We'll be joined by an expert who will break down the importance of oral health and raise awareness about its impact on our overall well-being. But before we do that, please, let's dive in. Click on our subscription button. On YouTube, you can find us on Voice of the People Television. On all other social media platforms, we are just at VOP TV Live. You may want to join the conversation. Send us a WhatsApp message on 090-5504-2974. The number will be right there on your screen. Well, now let's get right into the topic of discussion today. Like I mentioned earlier, today we will be focusing on World Oral Health Day, an annual event observed on the month of March to highlight the critical link between oral health and overall well-being. With oral health diseases affecting nearly 3.5 billion people globally, experts are urging greater awareness and actions to prioritize dental care. Untreated tooth decay remains the most common health conditions worldwide, yet oral hygiene often takes a backseat. Health professionals warn that poor oral care isn't just about cavities. It can lead to serious complications, including heart diseases, diabetes, and respiratory infections. This year's World Oral Health Day campaign focuses on the theme, A Happy Mouth is a Happy Mind, like I said before. The message underscores how oral health impacts confidence, social interactions, and even mental well-being. Experts say dental diseases like gum diseases and tooth loss can contribute to stress, anxiety, and self-consciousness, affecting overall quality of life. The 2025 campaign aims to debunk common myths and promote simple daily habits for a healthier smile. From regular brushing and flossing to routine dental checkups, oral care is more than just hygiene. It is a key part of a healthy lifestyle. All right, in the studio with me to dissect this and put better perspective to these stories today is Dr. Taiwo Shitu, who is a resident doctor in the Department of Restorative Dentistry, Lagos University Teaching Hospital, Idiaraba. He's also an oral health care advocate and visionary of FitMed. That's a physical fitness program targeted at healthcare providers. And he's also the General Secretary of the Association of Resident Doctors, RUTH. He's here to enlighten us on the importance of oral hygiene and better ways to enhance our oral health. Good afternoon. Good to have you, Dr. Taiwo.
Good afternoon, Promise. I'm delighted to be here today.
Thank you for joining us. Well, let's start off with the significance of this year Oral Health Day. The theme, A Happy Mouth is a Happy Mind. I'd like you to tell us the connection between a happy mind and a happy mouth. I think I like the sound of that. It's very captivating.
Yes,
I don't know how that connects, the mind connecting to the mouth. Is it a psychological thing? What's going on there?
Yeah, well, thank you very much. The connection between the mouth and the mind is quite straightforward, really, if we look at it in a way, because when your mouth or your teeth are healthy and you have this confident smile that is a beaming smile, and then you are all out there shining your teeth, and then you're happy, you're confident enough to go about your social interactions and all of that. But in situations where people either have a tooth decay, have lost one tooth or the other.
So they don't have that confidence.
You're not confident enough to interact with people. It affects various levels of interactions or relationships.
Yeah, because I think I'd agree with you, because our mouth is a very integral part of our body.
Yes.
That can never, it's very, very visible.
Yeah,
it can never be
said
hidden.
that the mouth is the gateway to the body.
Right.
So that a lot of things that happen in your body can be mirrored by what happens in your mouth and your teeth.
All right. With oral diseases, there is something about the story that I want you to put better perspective. So there are 3.5 billion people globally, experts say, that is affected with bad oral hygiene. That is a huge number. How many billion people do we have on the earth where you have 3.5 billion people being affected with oral hygiene? Now, I would like to bring it down to Nigeria, especially our young people. I'm trying to focus on young people because I could cut some older people some slack. You'd say they are older. But lots and high number of young people have very poor dental hygiene. I don't know about total mouth hygiene, but dental hygiene is a thing. And I mean, bad dental hygiene is something that's really poorly affecting us here. What are the better ways, and how are we going to try to sensitize people more on good oral hygiene, especially the young people?
Yes, I mean, for that, first of all, let me first correct this perception that the older people may be caught some slack, actually.
Well,
I mean,
people may say they are old.
Yes, but for as long as we have the privilege to be alive, our adult teeth or our permanent teeth can serve us, or should be able to serve us and be healthy for as long as we live. However, to your question directly, I would say that yes, it is really concerning for us, especially as dental practitioners, that a lot of younger people are coming down with dental issues, and some of this stems from dental or oral neglect, and then some of the perceptions that people have, some myths, some perceptions about.
We're going to go into that myth later.
Yes.
There is a segment for that later.
Yes, so some of those ideologies that people have about dental, and the fear, the phobia for the dental clinic is one of the things that keep people away from the dental clinic at the early phases of the conditions or diseases, such that at the time that they present, it is either that they are having severe toothache.
It's gone very severe.
Yes, or it has led to some other complications that will be more complex and more expensive to treat.
All right, now that you mentioned it, what is the ideal number of times to brush a day? Let's start from brushing our teeth. Because a lot of people believe it's once, it could be twice. Some people say it's once in the morning and then once in the evening. Some people believe it's just once a day. If you wake up and brush your teeth, it's okay once a day. Some believe that you don't even have to brush your teeth all day. So I'd like you to tell us the right thing to do there.
Okay, so I mean, quoting the numbers is easy, and then it can be easily argued by some other people. But if we understand the reason why it has been advised that people should brush twice every day, that is, then it will be relatable and easier to practice for people. So when you are going out for your daily, you want your breath to be fresh. And so even the ideal recommendation is that after your breakfast is when you should have that morning brush.
So we'll have to eat without brushing?
Well, if you have done the night brushing, that's before
so
you go to
cover the
bed,
breakfast.
it should cover for it. Do you understand? So that by the time you are going out, especially if you take something that has a smell or some,
you have quite a number of spicy food.
A lot of spicy foods, yes. Exactly, so that you go out, your breath is fresh when you are going about your daily activities. And then the most important one, as far as I'm concerned, is the brushing before going to bed. So here's what happens when you go to sleep. Your body systems, your body defenses, saliva production, as well as even your activity is down at that moment. So your defenses are down at the time you are sleeping. So usually we recommend that, and that's brushing before going to bed, so that you don't have food remnants in your mouth when you are going to bed. So that the bacteria that are in your mouth that usually would not be harmful at that time if you have food particles, especially sticky food. in your mouth, chocolates, lots of junk food, and when you go to bed. So they act on these remnants of food particles in your mouth, and then they lead to, they can cause you to have cavities. So that's why it's recommended that before you go to bed, you should brush so that the bacteria would not have any food remnants to act upon that can lead to tooth decay. So the recommended number of times to brush your teeth daily is twice.
Okay, in the morning after breakfast. I'm going to hold on to that. After breakfast and before after your dinner.
After your last meal for the day. Yes.
So now let's aside eating in the night and not brushing, are there any further causes of cavities?
Oh well, yes. There are. So the type of foods that you eat as well. So there are some kind of diets that have been implicated or as implicated as causes that have higher risk of making people to come down with dental cavities.
What are those foods?
Starting with the very common ones, sugary foods, your carbonated drinks or soft drinks as we call them, chocolates, lots of junk food, and food that have the tendency to stick to the surfaces of your teeth. Use plantain, especially before you go to bed. You know, all of those kind of foods that will stay on the surface of your teeth, even when you drink water or you rinse your mouth. So those are also types of food that can cause it. The way your oral hygiene practice is a very key cause, or one of the most important causes of tooth decay or cavities. Where if you don't take care of your teeth properly, you can come down with dental decay or tooth cavities.
Okay, so now that you mentioned, a lot of us here in Nigeria, I don't know if, let's say in Africa, we have very poor checkup routine, dental checkup routine. We don't see it as something that is really necessary for us. So I want you to tell us, how often do we have to visit our dentist for regular routine?
Okay, yes, for the dental checks, we have found that many of our population in Nigeria here, it's not that they don't want to check their teeth. There are a number of factors. First of all, the perceived cost of the dental checkup or
is it that expensive?
Not quite. I mean, if you consider the popular saying that that prevention is always better than and cheaper than cure. Leaving your teeth to without having a checkup that can detect those conditions early and treat them will lead you to even spending a lot more on dental and treatment on the long run. So that's a lot of people have this phobia for dental pain, toothache. Sorry, not toothache in this case. The pain that they perceive that they experience at the dentist, maybe from the childhood, and that's one of the reasons why our introduction of children to the dental practice or the dental clinic these days is in such a way that they have a pleasant experience at the dentist, so that as they grow older, they don't have this phobia or fear of coming to the dental clinic to have their teeth checked.
So we'll get to that of children, I think, towards the latter part of the discussion. But let's focus on tongue cleaning now. Is it just the teeth that causes poor oral hygiene, or does the tongue also follow? How do we have to clean our tongue if the tongue is a considerable effect to poor oral hygiene also?
Okay, so I like to consider the tongue as somebody that uses a rug in their home. You know, it has the capacity to absorb lots and lots of dirt on it, even without you really seeing it. And then it now comes up with its own, your tongue comes out, one of the ways that you would, is one of the things that accumulates particles or dirt that lead people to have bad breath, is the number of accumulations that they have on their tongues.
On their tongue.
So it's very important for that, apart from brushing your teeth, and that you should also pay attention to brushing your tongue as well. As frequently as you brush.
Do we need a separate brush
yes.
for the tongue?
Yes, ideally there is a tongue scraper. Okay. There's a device that is meant for brushing your tongue. But so in the event that you don't have a tongue scraper, which is the ideal, your toothbrush can also help to do that. But just brush gently so as not to damage the the cells on your tongue that help with the taste or your taste buds. Yes.
All right. Some people believe that using mouthwash, people use mouthwash, they don't even use toothpaste. They believe like if they gargle on mouthwash, they are good to go every morning. So I'd like you to tell us the kind of toothpaste. Some believe that non-fluoride toothpaste are better. Some say fluoride toothpaste are better. I'd like you to tell us the kind of toothpaste that is quite friendly for our teeth, and also mouthwash. Is it necessary for mouthwash to use mouthwash, or is it just a myth that, oh, you don't have to use mouthwash? You can, toothpaste is good to go. You're good to go with toothpaste.
The issue of mouthwashes is one that has generated a lot of controversies, even in the dental practice. Okay. So what we usually say is that there's nothing that can substitute for proper oral hygiene, that is brushing your teeth properly. When you brush your teeth, it actually takes away some physical, the mechanical action of your toothbrush takes away some deposits that you have on your teeth, the plaque, accumulated plaque on your teeth, and that
what
leads.
Is plaque? I'm sorry to cut
yes,
you short there.
That whitish deposits that we find on the teeth.
Between our teeth.
Yes, just immediately after you brush. No, on the surface of the teeth, even the front part of it.
Okay.
So those are the things that accumulate, and if
okay, the
over
one
time,
we find between our teeth are tartars. Am I right? Is it tartars?
Yeah. So it is the tartar is a sequel. It results from accumulated plaque that has been left for a long period. So what usually happens is that when everybody accumulates plaque easily. So even if you brush your teeth now, in the next 5-10 minutes, you're already beginning to accumulate plaque in your mouth. So, but the place of brushing is to take away that plaque. But if you don't do that regularly, or if you don't do that adequately, so the saliva in your mouth that contains minerals will, act on the plaque that has been accumulated, and it will now make it hard. So when it becomes hard, it becomes difficult to take off. Even that's so much that your toothbrush may not be able to even help at that point. So, and it is when we see, so for people that we see that have these yellowish deposits, greenish deposits on their teeth, it is because they've accumulated this what we call plaque over time that has now become tartar or calculus. Tartar also called calculus.
Is that also tooth decay?
No, it's not tooth decay. It's that colored deposit that we see on people's teeth. You see a lot of people that they have this around all their teeth. You see lots of, especially on the inner surfaces, that they cannot
yellowish
deposits. So over time, as those plaque has become solidified and becomes tartar, then they take up stains from the food that we eat, obviously. So and that is what confers that color that we usually see, usually from oily foods and all of that. So that's green color, yellowish color, and all of that. But at that point, it is almost impossible. Yes, almost impossible for your toothbrush to take it off. So at that point, you will need to get to the dentist to have it cleaned for scaling and polishing. Yes.
All right. So you've not still told us the kind of toothpaste. We don't have to mention names of brand, but is fluoride toothpaste better or non-fluoride? Some people believe also that charcoal toothpaste are better. Remember in the days after they say our forefathers used to use charcoal for their teeth. Which toothpaste is better?
Yes, for the teeth. Yes, to answer the question of toothpaste, as much as we don't recommend or prescribe brands. So the teaching is that it is what is obtainable here in our country. Okay. So every country, so in some other claims, they would say some other things about the fluoride contents of their toothpaste. Here in Nigeria, we do not have a public access to fluoridated water. Okay. So majority of what we have are people having their own personalized water systems, and all of that, and which we cannot even really. That
may not be treated by the way.
You understand? And then the milk that we consume, some other products that are sold in the market that actually contain fluoride in other climes don't contain as much here in Nigeria. Okay. So that is the reason why it is recommended that what we recommend here in Nigeria is that you should brush your teeth with fluoride containing toothpaste. And for twice. So
where does charcoal toothpaste come in? We also have charcoal. Is it better? Is it good for the teeth or not?
Well, we do not recommend charcoal toothpaste for the reason of one of the common side effects that it can have is tooth wear. If you use excessively, yes,
Okay.
tooth wearing
Where's the teeth?
of the surface of the teeth.
And that could
Something
cause
similar
teeth
to
sensitivity.
something similar to what brushing with very hard toothpaste does to you as well.
Very hard to brush.
Toothbrush, that is, yes.
So very hard to brush causes tooth sensitivity.
It causes tooth wear that can lead to tooth
Tooth
sensitivity.
sensitivity. What are the other causes of tooth sensitivity?
Sensitivity, if you consume lots of acid containing food, a lot of citrus fruits, that is lots of carbonated drinks, soft drinks, that is all those very high sugar containing. So all of this, they have a way of wearing off the protective layers of the protective material of your tooth. So and thereby exposing them to exposing your teeth to the inner parts of your teeth, which are more sensitive than the outer covering of it. That is the enamel. So anything that exposes the dentine, which is the inner layer of your teeth, will lead to tooth sensitivity.
All right, before we wrap up this segment and go for a break, I'd like us to mention few things. Some people here believe that white teeth are healthier teeth. There are people who don't really have. Is there anything like on a natural teeth that is not white, or are teeth supposed to be white? Are all teeth supposed to be white? And if that is correct or not, is a white teeth healthier than maybe colorish teeth that are not white? Or is it a myth?
That's a very, very important question that I really like people to know about. So that a healthy teeth is the most important thing. You having your teeth healthy, free of disease, and your breath
whether it's white or not.
So naturally, based on a number of factors, your race, your gender, and a number of other things, genetics as well.
Genetics.
So our teeth, the human teeth, the permanent human teeth, have a wide range, a variety of shades. Let me not say color now. Shades of white, ranging from a bit grayish white, so a variety of color, and all of these shades are perfectly healthy as long as you take care of them properly, and then
they are clean.
They are clean. So
right,
yes,
before we go, let's look at baby teeth. How do we manage? Because we cannot talk about this segment and talk about oral hygiene without mentioning babies and how to care for baby teeth. Some people feel that you don't necessarily have to clean the teeth of a baby, even if it's one tooth. Some people use towel or clothes to clean it. Is it healthy to take care of or to brush or clean a baby's tooth? If it is, what are the better ways to clean teeth of children?
Yes, that's also a very vital question for those that are having babies, because the best time to really catch dental challenges at at the time of birth of the child, or we usually say that the time for the first dental appointment of a child is when the first set of teeth begins to grow, and usually that happens about 6 months after birth. So yes, the baby teeth, as soon as they begin to grow, the baby should begin to have an appointment with the dentist. The teeth should be cleaned, not with not
toothbrush.
Not with the toothbrush
Okay.
Initially, but newer advances are coming up with baby-friendly toothbrushes that are coming up, and toothpaste that are more recommended, have lower fluoride content that will not damage the tooth of the child. So, but generally speaking, at that age, all you just need to do is to wipe off this, and you can. People have used cotton wools and all of that to do that, which is perfectly fine, as long as that baby's tooth and the gums as well are cleaned properly.
I think we'll talk about gums when we'll come back after this break. Thank you so much, Dr. Taiwo. You're educating us on, giving us better insights on things that we really do not know before. But we'll go on a quick break and return with tips on oral hygiene. Stay tuned.
In a world where truth is the ultimate power and opinions scream the loudest, it's time to wade through the noise.
Hunger no get tribe. Hunger no get religion.
And scan the human interest and trending topics that matter. Stay tuned to The Issues, your plug to the stories making the buzz, from politics to science and technology, social justice, and more. Let's tackle the tough questions and expose the truth. The Issues on Voice of the People Television, Mondays to Fridays, 8 to 9 p.m. The Issues. Don't just react, understand.
All right, welcome back. If you're just joining us, this is still Health Check on Voice of the People Television, and we're being joined by Dr. Taiwo Shitu. He's a resident doctor in the Department of Restorative Dentistry, Lagos University Teaching Hospital, Idi-Araba. He's also an oral health care advocate and visionary of FitMed, which we're going to talk about, by the way, which is a physical fitness program targeted at health care providers. And he's also the General Secretary of the Association of Resident Doctors in Luth. Yeah, Dr. Taiwo, we were talking about, before we went on the break, you were talking about the gums and how to, take care of them. I'd like you to tell us, educate us on how to take care of our gums too.
Okay, so what we generally refer to as the gums actually encompasses a lot more than that. It basically refers to the supporting structures of your teeth.
Okay.
And it just not just involves the gums, also includes the bones and some ligaments that hold your teeth in place. So it is when these structures, supporting structures, are healthy, your teeth are firm and they are also healthy. But when there's a compromise to any of these structures that I've mentioned, the gums, the bone that hold your teeth as well. There may be some serious issues like your teeth shaking, teeth becoming mobile, and all of that. So the care of the gum is pretty simple. And it's one of the things that is important. Your oral hygiene as well. But in this case now, some people do some overzealous practices like brushing with very hard toothbrushes. And this can have some damaging effects on your gums and cause them to bleed, which is not normal for you to bleed while you are brushing. Smoking as well, consumption of alcohol, excessive consumption of alcohol, and some of these things can have an impact on the health of your gums by altering the natural structure or form of those tissues, and eventually making them to become compromised. And then it can lead eventually to tooth loss.
All right. I'm still talking about the gums now. In an article, Experts, there is a segment that says that experts say that dental issues like gum disease and tooth loss can contribute to stress, anxiety, and self-consciousness, affecting our overall life. How does a bleeding gum affects or causes anxiety and affects your general well-being. Some people, it may not make sense to them, but I know you're going to help us
Yes,
make sense of that.
I get the question. So, but that really refer to what I just described earlier, like that combination of the supporting structures of your mouth. When your gums are bleeding, it's an indicator that there's something that is off about one of those structures, whether your gums or the bones around your teeth. So eventually it can lead to your teeth becoming mobile, that is, they are shaking. And if your teeth are shaking, I'm sure that
as an adult.
Yes, as an adult, there's no, you will not be happy about it. And then
so that could lead to
loss of that tooth. Yes, on the long run. However, there are the compromise to the teeth or the gums rather, as it's where it can be an indicator of even more serious medical conditions going on in the body, like diabetes, some oral cancers.
Yes, I was about going there because it says that poor hygiene can lead to heart disease, diabetes, and also respiratory infections. How does poor oral hygiene have to affect your heart, lead to respiratory infections and diabetes of all of that? Isn't diabetes hereditary? I know at some point diabetes are hereditary, right?
Yes. So the thing with diabetes, some of the oral cancers that you have mentioned, and so it's more like is the reverse. So some of those things can lead to you having some gum disease or some issues with the supporting structures of your teeth. So that's why I mentioned earlier that the mouth is the mirror or the gateway to the body. So some people, there are some patients that we have seen in the dental clinics that we found out about their diabetes condition at the dental clinic first.
Wow.
Before then referring them to the clinical clinicians to manage the diabetes, just because we have found some of the symptoms that we usually or signs rather that we will find commonly in patients that have diabetes, and then we investigate further and then refer them appropriately to the endocrinologist to manage their conditions. So yes, in some cases of when you have plaque accumulated around your teeth, that plaque is mainly bacteria.
Okay.
And so, when that bacteria finds its way into your blood, your bloodstream, that is the way that it can lead to heart problem. I'm avoiding to go into the technical details of it. But for the other conditions, diabetes and all of that, is more like the condition actually affects those your gums and those supporting tissues of your mouth that makes them compromised, make them to swell in an abnormal fashion, and then we begin to get some feelers that this person may be having something that is a lot more than just a dental or oral issue.
All right, so let's also look at, I know we've spoken about the teeth for so long, but I want you to teach us, like a layman, we're laymen anyway, so I want you to teach us the practical way of brushing our teeth. I remember when I was in secondary school, I think there's this dentist that say you brush your teeth up down like this, up, down like this. But what is the ideal way to brush your teeth to get better results?
Okay, so for tooth brushing, it's something that has been spoken about and researched about. There's several techniques of toothbrushing, and it varies what you do, varies by from what you depending on what you have in your mouth. So I usually like to say this, that toothbrushing is an art, as an ART. So that it's not something that you just do blindly, that you're just brushing
something you have to learn.
You are consciously, I say this, that you with your toothbrush in your mouth, and first of all, I also need to mention that the type of toothbrush that you use, recommended toothbrush texture for an adult is a medium textured toothbrush, not too hard and definitely not soft. So when you have that, and you're for a Nigerian living in Nigeria, your fluoride containing toothpaste, and when you are armed with that tool, so you consider that you are brushing your teeth. Just imagine that you can see your mouth, and then you are taking it from, and I usually recommend that, you should start from one part of your mouth, so that you can really account for every single tooth while you are doing your toothbrushing. So whether I want to start from the top left or from the top right, depending on where I start from. So I take the outer part one after the other.
Up and down movement,
so
in a circular movement.
So the recommended way that we usually commonly recommend to people is that you should brush away from your gums. So that means that when you are brushing your upper teeth at an angle of 45 degrees, you are brushing from top to bottom. You're brushing away from the gums. And then when you're brushing the lower teeth, you are brushing away from the gums. That means you are brushing your lower teeth up, and you are brushing
that
your...
isn't fun. That could slow someone
well,
down.
I would say
real.
that it's like I mentioned, it's an art. So that it's something that you get used to.
And it's a boring way of brushing, by the way.
It's something that you get used to with time. I agree with you.
And we'll consider time factor there. People are getting ready to get to work. How many people have the patience to do that before they rush off to work?
Now, the thing is that when you have mastered this process of brushing, it usually will take about 2 minutes thereabouts for you to complete,
like you said,
the whole thing.
People have to learn.
So, and very importantly, a lot of us, we usually neglect the inner parts of our mouth, of our teeth while we are brushing. So majority of people, once they just brush the front part of their teeth that they can see, they just, so it's as well as after brushing all of the outer part of your teeth from one corner of your mouth to the other end, then go to the lower part, then go to the inner part as well. You also, like you
just
mentioned,
away from the gum.
So like you mentioned, it's not something that is very easy to do at the start. But the more you do it, the more you get better, and you get better with it, and then you get faster also with doing it. So that's.
So do we brush and rinse? Because we've heard a lot of things about brushing. From brushing once to you brush and spit out and not rinse your mouth. Some people say no, you have to spit out and brush again. Do we have, just tell us the routine of brushing. Do you brush and rinse, or you brush and just spit out and let the toothpaste simmer in your mouth to fight more bacteria, or perhaps better fresh?
You have spoken the exact breath. You've spoken the mind of the proponents of the brush without rinsing. So, and it stands to reason. So the fluoride in your toothpaste, apart from the mechanical function of action of you brushing and getting rid of any food remnants or deposits on your teeth, there's a chemical component of your toothbrushing as well, whereby the fluoride in the toothpaste that you are using seeps into the structure or the material of your tooth. You understand? And so the proponents of that theory say that the longer the toothpaste has to be on the surface of your teeth, the longer the effect and the higher the chances that they will be able to seep into your
question. Yeah, so let's talk about FitMed. What is FitMed about? Let's talk about it.
Okay.
Before we go to the myth or fact of toothbrushing, and we'll wrap up.
Well, FitMed is a program that I envisioned about a couple of years back now, and then usually as health practitioners, we usually advise people and counsel them about their lifestyle, which is a very key part of general health. To avoid sedentary lifestyle, move your body, engage in sports or physical activities, exercises generally. And I realized that many of us as medical practitioners do not do what we preach, do not practice what we preach. So I sort of envisioned shifting the focus from the general population to the people that are advising, they're giving the advices on how to live and how to live healthy, so that people can actually see what we are preaching to them in us as medical practitioners. So that's why I
Because
brought,
some of you barely have time for yourself.
yes, a lot.
You work yourself
the
out.
workload, and I mean, considering the doctor to patient
patients
ratio
in Nigeria.
that we have in the country,
no,
the brain
don't
drain
go
and all
there.
of that.
Yes,
It's a lot. It can be
terrible.
overwhelming
Yes,
at times
it
that
is.
people don't even have time to eat.
For themselves.
Yes,
And there are
so-
cases of doctors working and collapsing and dying in
A lot of that happens, and so that's the this thing that basically an avenue for doctors to also pay attention to their own health, and also especially physical activity, exercises. You know, do your checks, know your numbers, so that if you realize that something is going wrong, you can also attend to your own health very importantly, so that you'll be able to save the
because
patients
you need
that
your
you
health
have.
to save other health.
Very important.
I don't know if that makes
Yes,
sense.
yes,
So let's go on
it
the
does.
myth segment, and we don't have time. I wish we go on a short break. Can we go on a short break and return and do the myth and wrap up? All right, so let's talk about the myth now and facts. Dr. Taiwo, so you just answer me myth or fact. You tell me if it's a myth or fact. So the fact is that, is it a myth or fact?
It's a myth. It's a myth.
All right. So another one is gum disease is only a concern for your mouth. It doesn't affect other parts of your body. We've already talked about that.
Yes, we have.
Is it a myth or a fact?
It's
We
a myth.
confirm.
It's a myth because yes.
All right. Also, people believe that chewing gums works like brushing your teeth. So when you just chew gum, you don't have to brush your teeth. After all, the gum, especially minty gums, makes your teeth fresher. So you're good to go.
Oh well.
Is it a myth or a fact?
It has its own role, but it's still a myth.
All
It has its own role, but it's still a myth. Nothing replaces your toothbrushing.
So there is also a belief that, I think, talking about chewing gums now, does it damage your teeth in any way?
Yes, it does. The sugar content of this is similar, something similar to the same thing that we'll be talking about. The sugar contents of this. So for
All
those
right.
that are compulsive chewers, we recommend sugarless gums for them.
All right. Final one is only sugar causes tooth decay. Is it a myth or a fact? Are there other causes, factors of tooth decay, or it's just sugars?
That's a myth as well, because it's a combination of a number of factors: the bacteria that causes tooth decay, the sugar content, your oral hygiene, as well as the diet that you take.
All right, this has been an interesting conversation. Thank you so much, Dr. Taiwo.
I'm always happy to speak to
I
people
hope you
about.
join us very soon next time. So thank you so much
Thank you
once
very
again
much for
joining
having me.
us. Yes.
I'm delighted to be here.
All right. Of course, Dr. Taiwo Shitu is a resident doctor in the Department of Restorative Dentistry, Lagos State University Hospital, Teaching Hospital, Idiaraba. You can catch him there. He's also an oral health care advocate and visionary of FitMed, which we spoke about, and also the General Secretary of the Association of Resident Doctors. Stay tuned. Health Check will come your way. It comes your way, by the way, every Saturday by 2 p.m. Do not forget, every Saturday by 2 p.m. Here we'll give you healthy tips on how to keep your life healthy and the do's and don'ts, things you have to do and things you don't have to do. Don't forget to join us next week for another interesting episode. I am promised. Have yourself a wonderful day.